Hello to all of you on the webinar. Thank you so much for being here this afternoon. My name is Emma Curry. I am Vice President of ESCOM and one of the owners of ESCOM as well. I am doing this webinar, this informational webinar today on behalf of Jason Curry, who is our CEO. Jason is deaf himself and runs our company ESCOM, basically using a UbiDuo. So in the interest of our hour today, we're going to have this as our time frame here. We'll do about 8 to 9 minutes, just as a reminder of with whom to use the UbiDuo, what places to put it in, and then we'll do about 30 to 35 minutes of hands-on with the UbiDuo for those of you who have them, and then let's have the last minutes to be for your questions. And in between the reminder of with whom to use the UbiDuo and where to place it, we'll also pause for some questions right then as we move into you opening up your UbiDuo and having them as we go through the features of the Ubi. So welcome again. Thank you for being here. We are a Kansas City, Missouri company. We have been deploying Ubis and working with people to have communication face-to-face, both people who are hearing and people who are deaf, since 2006. And that is what we continue today. That is our entire focus, to make communication smooth for both people who are hearing and people who are deaf. So I just need to move the slide.
Which one? Okay. Oh, the pencil.
So again, thank you all for being here. We're just going to review here very quickly. These are the communication tools that in the past people who are deaf and people who are hearing have been used to using. Paper and pen, which is the oldest one, is the most inefficient one, but it is the oldest one. Instant messaging, people trying to lip read, people trying to learn some sign language. There are video relay services now, and there are video remote interpreting services now, which is a third-party interpreting system. There are on-site interpreters, and then we have court reporters. The missing piece has always been the ability to communicate face-to-face without needing a third party, or without needing the internet, or without needing anything, so that people could individually, on their own, face-to-face, be able to communicate. And that is the reason that the National Institutes of Health funded the development of the UbiDuo. In their words, there was a desperate need for people who were hearing to be able to communicate with people who are deaf right on the spot in any location, in any place. And so the slides you're seeing here, of course, UbiDuos are used by police departments, they're used by sheriff's departments, they're used in correctional facilities, they can be used to talk to anyone, they can be used to do pre-discussions, they can be used for intake, they can be used to communicate in any way, and it of course is much more efficient than communicating with paper and pencil. So those are the circumstances and the situations, and we just want you to see these pictures because the Ubi can be moved in any location. It doesn't have to be stationary. People don't have to be brought to it. And you are able to use it for medical screenings. You can use it for classification, whatever. This picture right here is a person who's walking into an office and just wanting to be served. So the whole idea of the Ubi is to have it always out. Again, the Ubis are priceless out where they can be used in a second's notice, worthless in a closet or a drawer. So these are pictures of how other people have chosen to have their Ubis. So here we are. That is the picture of the UbiDuo, and it will it does enable people who are deaf and people who are hearing to be able to communicate instantly right on the spot with that split screen, which is a part of our patent, and this instant communication so that every keystroke is seen by everybody. And again, here we're just wanting to remind you who you can use these Ubis with. This young man, I think some of you know this young man right here in the tan shirt had interviewed many, many places with an interpreter. And not that interpreters are not valuable, but he had interviewed and he had not been able to be employed. He asked to have a UB, to borrow UB, and he interviewed with his UB, and he now works one of the information desks at the Bill Clinton Presidential Library in Little Rock. This young man is a college counselor. Colleges use UBs, of course. It enables students to be able to walk into financial aid. It enables them to be able to walk in to any facility, to admissions office, and so that their experience can be just the same as a student who is hearing, who can walk in and access any of the services. And it also enables students to be able to take their UBs, just like this young man did, interview for part-time jobs during their college experience, and also interview in employers. Again, having these UBs just out on the desk so that anytime anybody walks in, they can just start typing. And so I just want to remind you again that who you would use the UB with is people who are deaf. People who are deaf, that's a general statement, but they do live on the keyboard. They are texting, they're using emails. So this is a full-size keyboard. Anytime we do a survey and ask people who use UBs if they want this keyboard smaller, the answer is always the same, absolutely not. If you're going to live on this keyboard, use it all day long to talk to your coworkers, or if you are a correctional facility and you're going to use it in a serious way, people want a full-size keyboard so it's easy, and they want a hard service keyboard so that it's easy to communicate back and forth. These are also increasingly used with people who've had hearing and lost it. Those people will speak back. But they need a way to receive clear information. And they don't know sign language anyway. And the last three are not as common, but again, use these UBs with people who are on a trach. They can hear you, but they need a way to express, and the same for people who have expressive stuttering. And here's just a picture that's an example of that. This is an assisted living center. This man in the vest was a missionary in Africa for 27 years. He's lost all of his hearing. And the only way that he can really communicate and be able to interact in the conversation if someone is typing to him, and then he will speak back. That's also true now in banks. Banks are using UBs with their customers who are older, who've had hearing and lost it. Instead of everybody shouting to mom or dad or shouting to the person, someone is typing to them so they can have clear information. Also true in hospitals. It's true in all facilities that UBs are being used with people who've had hearing and lost it. So here are the features of the UB, and we are going to go over them in detail in just a minute. But of course, this is a touch screen, has a 12-hour battery life. UBs are in many, many information booths at the front counters. This is just a picture at Mount Rushmore. The National Park Service uses UBs. The whole idea, again, is so that people who are hearing can be able to communicate with people who are deaf. People who are hearing want to be able to answer questions. They want to get their job done just as much as people who are deaf want to have information. So this is one at Crazy Horse. Again, all of those areas, the National Park Service have UBs. Any place where people need information, whether it is for recreational use or where it's very serious, like it's in a medical facility or correctional facility or a hospital, people want to be able to be served. This picture of this young man is just a reminder to our universities and our colleges that our students who are deaf can be in those automotive programs. They can be in the electrician programs. And if they have a UB, then they can serve anybody who comes into their shop, anybody that they need to go, and if they're doing electrical wiring, if they're doing a building, because the UB will make that possible for college students or for anyone to be able to function and interact with anybody. This picture is just to remind you these UBs can be used anywhere. They don't need the internet. They don't need Wi-Fi. They don't need anything but themselves. Anyone can talk to anybody in any circumstance. Actually, I have seen UBs folded out on the hood of a police car even. So this is just, again, a reminder, just a fun slide to remind you that you can put these in a backpack. They can be anywhere. They're very lightweight, weigh a little over 3 pounds, and you can talk to anybody anywhere without the internet, without Wi-Fi. Serious situations and recreational situations. Of course, the UbiDuo meets all of the ADA compliance requirements. Your reason for doing that is communication, but just so you know, the Department of Justice has made it clear that the ADA meets compliance requirements. This slide is just a reminder. We have a UB in all of the Department of Motor Vehicles offices in Washington, D.C., and they will be happy to be a reference for any of you. If you would like to talk to them, you can call me and I will give you their number. They'd be happy to do that. So again, this is real time. We're going to see that in just a minute. Whatever you type will appear on the upper screen. The other person will receive it on the lower screen. And this is the whole purpose of the UB, so that there wouldn't just be communication at a time when you might call in an interpreter, which is what these blue dots represent. But in fact, you would be able to communicate 24 hours a day, 365 days a year, easily and quickly in a communication mode that people who are deaf are absolutely familiar with using. So this is one last slide of Fresno State University. Fresno has about 100 UBs on their campus. They use them in every possible way. But again, they're always out on the counter. They're able to be used. They're used in medical settings. They're used in admissions. They're used in financial aid all over the campus. In their campus, they also allow their students to carry them and they take them to interview for jobs. Social Security did put a UB in every office in the United States for these same reasons, so that when people who were deaf could walk in, their hearing staff could serve them on the spot, so that there wasn't delay and everybody could be satisfied with the transaction. Of course, they're used in medical settings, in hospitals, in emergency rooms. They're used in any kind of setting where immediate communication is helpful so that you can move your person forward. Again, another doctor in his office. They're used in every kind of individual way. The UbiDuo speech generating device has been approved by Medicare so that individuals can more readily be able to have a UB and communicate. And then we'll just end this part with some fun slides. As I told whoever was from San Diego, when we rolled out the UbiDuo speech generating device, the person who came, that is our CEO there on the right, who is deaf, and the person who came to try it that very first day was Stevie Wonder. And our CEO typed. Stevie could, you can see the microphone there. Stevie could hear what Jason was typing, and then Jason could read what Stevie was typing back. And the whole point of this slide really is that people in every environment can develop relationships that are so totally unexpected that they have never been able to do before. So then that is the purpose of the UB, so that everybody can be able to communicate anytime, any place, and it will be smooth. So that's just that reminder of who to use the UB with. And now we are going to open up your UBs and talk about how easy it is to use. And I just want to be sure that we're good with everybody. And if anybody has any questions, just type your questions in, and Ben, who's sitting right here by me, will be able to respond to those. But this first slide that you see up here now is a slide that we did not used to put at the beginning, but we do now, because we want you to open the UB on a flat surface so that when you pull those J-hooks apart, to pull the pieces apart, you don't in any way damage the J-hooks or damage the slots. So, and the reason we say that, we saw a lot of nurses and doctors opening them up on their knees in hospital rooms, and also students carrying them out and the student commons and kind of opening up on their knees and handing one half to another student to be able to talk. But they really need to be opened on a flat surface. So I'm hopeful that right now you will open this on a flat surface and pull the two pieces apart. But I would like you to also, now I would like you to put the pieces back together. And the reason I want you to do that, I'd like you to put them back together on a flat surface, but I would like you to make sure they are connected very, very tightly so that when you fold the pieces back over against themselves, you won't knock the keycaps off. So, for example, in correctional facilities, you might move that to the front desk or to do an interview with someone, or you might take it back into a more secure area. Again, it doesn't need the internet or Wi-Fi. Nothing will interfere with it. And you might also want to use it with someone that you felt not as comfortable with, and you'd want to give them one side where they were, and you would be on another side. The pieces don't have to be next to each other. So now that you've opened them up and you've put them back together, I would like you to open them up again, and we'll look at the features. So how to turn the UB on is you just hold down on the small button that's up on the right of the UbiDuo, that right arm, and then the screen, the little circle will glow blue. That's also how you turn it off. But for now, if you would leave it on, and if you would take your hands and pull the screen up toward yourself, you may, if your UB is brand new, you may have to hold on to the arms to pull it up so that the screen is up facing you, and then it will look like this. And if you're just one person on this by yourself, you can turn both pieces around so you can see both pieces. But once you've turned it on, that screen will instantly split. It will instantly split, and you could just start typing. We do train everyone free, everyone. However, if all you knew was to turn this on and start typing, it would work. We do tell that to sheriff's departments. We say even if one of your people has not had a full training, just tell them on this, turn this on and start typing, and people who are deaf will immediately start responding, because it is how people who are deaf are communicating all the time now. So you'll turn it on, the screen will split, and you will see that you would be able to start typing. I would like you to look, though, on the left-hand side of your UB, there is a slot. It's a slot for a Kensington lock. We don't have anything to do with the Kensington Company, but many government agencies who have UBs in their lobby will lock down the pieces just so they're there. We have police departments that lock down one side out in the lobby, and the other side is then behind the screen or the glass. So because so many people use that lockdown feature, we put a slot on as a courtesy, but we really don't have anything to do with providing locks or anything to do with that company. So then I would like you to look on the other side of your UB. There is a port for a USB, and we're going to talk about that. You can save a conversation to a flash drive. You'll be able to move it out to a computer and save it in your records. There's a slot for an HDMI port. In our company, we're half employees who are deaf, half are hearing. We often have meetings by connecting to an HDMI port, and then we're typing for everyone, and it projects on a screen. And that's the same. Colleges do that as well. People who have multiple people who are deaf in a meeting often do that. City councils do that. They have UBs. City hall meetings have UBs. Of course, it makes them ADA compliant. Then if someone who is deaf or who's lost their hearing steps in, they can just start projecting to a screen. Then there is a little tiny micro USB charging port, and you charge these up at night. Both sides have to be charged up just like you do a cell phone. So that is an overview of how the UB looks. And and I will send any of you who would like this PowerPoint, I'll be happy to send it to you. But now what's up on the screen in front of you, I would like you to hit your escape key on the upper left of your keyboard and come back out to the main menu. and you will see that it says split screen settings and saved. And I would like you to touch that split screen so you can see that it'll just bring you right back to the split screen. And there you can see that slide that shows you that. When you're on the split screen, again, all you have to do is start typing. It's going to show you letter for letter on the other side exactly what's being said, and that's important. It's important, for example, in sheriff's departments, that when people are very excited or they have things to say, both people can type at the same time. You can just keep on typing. You don't ever have to enter. It'll just keep wrapping, and the person can keep saying whatever they're saying. That's also true in the emergency room in a hospital or in a medical clinic, sometimes in a college setting. So both people can be typing at the same time. It's real time. And of course, both halves have to be turned on for that split screen to come on. You do have to turn on both sides of your Ubi at the same time, but it is going to appear on both screens. We won't do that here on this training, but I want you to be aware that you can scroll back through your conversation using the up and down arrow keys, the right and left keys. You'll be able to see where you are in the conversation. If you wanted to see what your chat partner's conversation, you wanted to scroll that instead, you can hold down on the tab key and you can scroll. We're not going to do it right at this moment. At the end, we're going to have some questions. So in case, and we're going to go through this so that everybody gets the review of how to use it, then we'll do those individual questions. So, but now I would like you to be able to change the font size, and the screen that you're looking at now, if you will touch either the upper half of the Ubi screen or the lower half of the Ubi screen, it will drop you down a screen that says Family Style Point. And if you will touch Point and either hit Enter or touch Accept, it'll drop you down a screen that would change those font size clear up to 72. People with low vision who are deaf have asked for those larger font size. Also, people who are hearing, who are talking to people who have low vision, want those larger font sizes. So whatever you set that at, when you hit Escape back and come back to the split screen, it'll be that font size. So I want to give you just a minute here to be able to do that. And if there at any point along you want to ask a question again, just type your question to Ben, and we will go along here so we'll kind of accommodate looking at all the features, and then we'll take the questions. So again, I would like you to exit the split screen. Just hit the Escape key on the upper left of your keyboard. This is an easy, intuitive device to use. Again, we train everybody just so you're aware of the features, but you could honestly touch this and it will lead you through what you might want to need. So if now you would touch that settings icon, it'll bring you up 8 icons. Brightness, split screen, the fonts and colors. There's several ways to do the features on the Ubi. So if you'll touch that settings icon, you can see that you could slide your finger and move it back and forth, and it would control the brightness in that backlight. Actually, mostly people with low vision do that. They know what they want that brightness level to be, but that is how you would do that. Now, if you will hit Escape and come back to the main menu, and then touch the split screen option, most people want this screen to split horizontally, but we have had some people who prefer it to split vertically. And when you touch that, it will change that. It will change it to vertical or horizontal. So again, they're all set for horizontal because most people want the UB to be split horizontally, but I want to make you aware that if you are the user all the time and you want it vertically, that you certainly can do that. Then I would like you to hit escape and come back to those settings icons. And you could touch the fonts and colors icon, and there again, you'd be able to change the fonts. There are 3 ways to do all of this, and whatever is the easiest for you, but you could change the fonts there again. So again, that settings, here they are. Those are those main icons up here again. This in range we are not going to do here because I think most of you have one UB. However, I'll be happy to do that later. This in range, if you had 2 UBs, you could connect all 4 pieces of UBs, and the screen will split into 4s, and all 4 people can talk at the same time. So colleges often do that. So a student who's deaf can be in a study group with 3 students who are hearing, or 2 students who are deaf can be in a study group with 2 people who are hearing. Or we even have had sheriff's departments where the mom and dad were deaf and they wanted to talk to them both at the same time, and they split the screen and so everybody could talk at the same time. We'll go through how to do that. It's easy to do, but we'll go through that at the end if we have time. The other thing that you're seeing up here on the screen is the time and date. All of these were set for Central Standard Time because we're a Kansas City, Missouri company here in Central Time. But when you go to set your date for your time zone, whether it's the East Coast, Pacific Coast, wherever you are, use the arrow keys. Don't try to type into the spaces. That won't work. But if you will arrow the keys over or up and down, you'll be able to change the time where you are. Probably the date on these is mostly correct, but you'll be able to change that, the time on there. Now I would like you to touch this icon that says UBID. I'm going to click this up here. And all your UBs will probably have a number there, but if you would backspace out that number, for example, it might say on one side Pettis County Sheriff, on the other side it might say guest. You can set either side to whatever you want it to say. In a college setting, if it is a professor, we have professors who are deaf who use UBs, they have their name there. On the other side it can say student. You can name each side whatever you want, and when you print out your conversation, if you do, it will then show who has said each part of the conversation. That's also true in interviews with a correctional facility, or it's also true in a hospital setting. So you can go in and name your UBs. You can leave the numbers in there, but I think most people prefer to go in and name the UBs. And you may not be able to do that right now on this webinar, but it's easy to do, and you can go right in there and put names on the side of your UBs. For example, if you're a bank in Hawaii, which we do have banks in Hawaii using UBs, you might have the name of your bank on one side and the name, just customer, on the other. But you can go in and name those sides of the UBs. You will not be using this administrator key. I just want to tell you what it is. It's a high security feature that the National Security Agency asked us for. So basically the National Security Agency and NASA itself and the FBI use that. We have the icon on there, but you won't be using that. And then about, when you click on about, it'll just tell you the version of software that is in there. And remember, our CEO is deaf, so his number one priority is that if anything would go wrong with your UB, that it would be taken care of immediately. That if in a troubleshooting situation, we did not help you figure out what was happening, then we will send you a loaner UB so that you are not without communication, and you will send yours back to us, and we would see what the repair is. We build a very solidly good product. We have people still, even though the first UB version is totally end of life, we can't even get parts for it. Many of those UBs are still being used today. So now I would like you to come back out to your split screen. I'd like you to all escape clear back out to you actually on the split screen itself. And I'd like you to type something to each other because I want to show you how to save a conversation. So please come back out to the split screen, and it will be up to your agency whether you're saving or you're not saving. We don't determine that for you one way or the other. That is up to you all. The U.S. Postal Service uses UBs. Again, whatever you decide your policy is, that's what will take precedence. But now I would like you to type 3 or 4 lines to whoever's doing the volunteer typing. And then if you'll hold down on the control key on the bottom left of your keyboard and the S key at the same time, you will see a screen pop up that says chat log. And if you would backspace out those letters, chat log, and if you just type your name in there temporarily, because you can delete this, just type your name in there and then either hit accept or hit enter. That will save that conversation instantly, and a blue line will come across the screen and you will see that it is saved. So I am thinking here, I'm just imaging you all having done that. And now if you will hit your escape key on the upper left and come back out to the main menu one more time. And then here, and we're going to show it to you up here on the screen. And do you see the saved icon up on the screen? If you will now touch the saved icon, it'll bring you up a list of what you've just saved and what you've named it. And when you touch the name of your file that you named it, it will drop you down the whole conversation and you'd be able to review it. And on your UB, then, you can either delete that conversation, or you can save it again in the UB, or you can put a USB into the UB at that point, and it will transfer it to the USB, and you can then put it in a computer, and it will save it as a text document, and you can change it to whatever kind of document you want and keep it in your files, in your records. So the save feature is a really important feature for anyone who needs to document conversations, anyone who needs to have records. Often, for example, in a hospital, for example, an older patient who is in a bed, who is deaf, wants to save the conversation with the doctor, so when their children come in at night, they can bring it up on the UB and their children can see what they said. In sheriff's departments, they often want to save those interviews. If there is a PREA discussion, whatever, if they want to save those, they can certainly save them right there. Now, I want to show you all the shortcuts on the UB, and I would like you to come back out to your split screen by hitting escape, being back out on the split screen, and I want you to know that the top row of keys, F2, F3, F4, are emoticons if they're used all by themselves. So when people are, in fact, get really used to using the UB and they're using it a lot, they do put those emoticons up there. Just want you to know they're on there. But now, if you would touch just the F1 key, just the function key on the lower left of your keyboard and the F1 key on the top left, it will drop you down all the help menus that are on this UB that you can use quickly. And I want to tell you that the shortcut that is used almost the most of anything is the one I'm circling on this screen right now. And it's when you have typed something on your UB and you want to clear both screens, you hold down on the Shift key on the lower left and the F7 key at the top. And I want to give you some moments to do that now because that really is the shortcut that people use. They type and then they, for example, in a bank, they want to clear that out before somebody walks away. Or if somebody has done an in-depth discussion with somebody at Social Security, they want to clear that out as the patron walks away. In any circumstance, colleges with financial aid, they want to clear that out. So it's Shift plus F7, and it is the most used shortcut on the whole UB. I do want to remind you that if you want to save your conversation, you must save it before you clear your screens. If you clear your screens, you can never get it back. Also, if you turn your UB off, you can never get it back. So I just want you to know that. I would like you to arrow down, and there is one more shortcut on here that I don't have up on this slide, but I want you to see it on your UB. And it is the shortcut that allows you to set a message, a predetermined message. And you will see that shortcut listed there. And if you do hold down on the function key and the F11 key, then you can type in Pettis County Sheriff's Department, please start typing. Or Pettis County Sheriff's Department, how may I help you? Whatever. Or Pettis County Sheriff's Department, we're going to do your PREA discussion here. Whatever you want to put on there, you can create that predetermined message. And then when you hold down on the function key and F12 key, it'll bring it up every time without having to type it in. So again, on this training, we don't have time for you to put in all your messages now and then you bring them up, but you will want to do that. We have emergency room hospitals that say, Bothell Hospital, I am your nurse, please tell me what happened, please start typing. Or in colleges where people have them in financial aid or whatever, they may have the message that say, I will answer all your questions about for financial aid, please start typing. So you do want to go in and pre-program your messages so that it just makes it easy and convenient. The whole goal of the UB is to make it easy for people who are hearing to talk with people who are deaf the same way. Interpreters are just not standing where people who are deaf are 95% of the time. But there are other reasons to use the UB. There's a privacy issue, and there's also the issue of making sure everything is clear so there's no confusion or misunderstanding coming through a third person, that you're actually talking straight to that person, they're responding straight to you, and people who are deaf are doing that every day with other kinds of keyboards. So again, we've gone over the features with people with low vision. I just want to tell you again, the reason for that slide with the young man hiking the Appalachian Trail was to remind you that this battery will stay up for about 12 hours. Often it'll stay up longer, but you do need to designate somebody to charge it up at night. We have people who are using it on the night shift. Of course, you can use it plugged in, but at some point if it might not be being used, you would want to plug it in and charge it up. So I've tried to stay within this time frame that we agreed on so that we have enough time for your questions. And I am going to unmute everybody. And then I know as you've tried to look at this, you've had questions come up. I would also, if you have specific circumstances that you've been confronted with before and wonder how the UB could help that, I just want to tell you, we have UBs in every possible agency, every possible kind of business, every possible kind of setting. We have UBs that have been used in the top of the mountains, in the middle of a lake, both recreationally and in very serious situations. I am an interpreter myself. Among the many reasons I know interpreters are not available, they're just not standing where people are 95% of the time. In addition, obviously, there is a cost. That cost can be anywhere from $75 an hour with a 2-hour minimum to $125 an hour. But the huge thing is that an interpreter has to be scheduled in advance, and most often all these conversations can take place in the convenience of the time frame that you need them to take place, and also with a lot of privacy. So I'm going to